Hello everyone, welcome back to our channel. When it comes to OET speaking under clinical communication criteria, one of the key aspects of this is summarizing information. What do you mean by summarizing information? When interacting with a patient or a relative, simply receiving information is not enough. You need to truly understand and confirm the patient needs by summarizing the information back to them, which is a very important thing. So, this gives the patient a chance to correct any miscommunication and provide them with more accurate details. And let's see why this summarizing important. By summarizing, you are showing that you have heard the patient and you are seeking confirmation that you have understood them correctly. So, this encourages the patient to provide more details, which is very essential in the healthcare field to ensure accurate diagnosis and treatment. Let's see an example here in a general context. From what I understand, you have been feeling headaches for the past 3 days, and it seems like stress at work may be causing it. Is that correct? So, here you are summarizing the key points like headaches for 3 days and stress a cause, and asking if it aligns with what the patient is feeling. So, here you are giving the patient a chance to confirm or correct your understanding. Another example, a doctor is saying here like this. So, what you're saying is that you have been having trouble sleeping at night because of the noise from the construction outside, and it's making you feel more tired during the day. Would you say that's accurate? Here, you are summarizing the patient issue with sleep disturbances due to an external noise, and you are also prompting them to elaborate further if necessary. Got it? Let's see some of the do's and don'ts. You need to use clear and concise language when summarizing and try to ask the patient for the information whether it is correct by using phrases like, is that right? Would you agree? And make sure to pause after summarizing and give the patient time to add more information. There are some certain things that you should not do when you're summarizing the information. Let's see that. Don't just repeat information without asking for confirmation. And do not try to interrupt the patient while they are speaking. And don't skip inviting for further clarification. Always ensure they have the chance to clarify. Let's move on to some of the indicators for information giving. This criterion is very important as it focuses on how well you convey information to your patient in a way that considers their existing knowledge and emotional states. There are five key aspects to focus on. Let's see one by one. The first one is establishing initially what the patient already knows. Here, before providing new information, it's very important to understand what the patient already knows. So, this helps you tailor your communication and avoid overwhelming them with unnecessary details. Example, I just want to check before we go into the treatment options. Have you been informed about your condition and the test you have undergone so far? So here you are asking, you are pausing periodically when giving information, and you are setting a foundation here, ensuring. So in this statement, you are setting a foundation here, ensuring that the patient is not being told something they already know. This shows respect for their knowledge and helps avoid repeating the same information. Let's move on to the next criteria. Pausing periodically when giving information, using the response to guide next steps. Because when you're explaining things, it's essential to pause and gauge the patient's response. This will help guide your next steps in communication, ensuring they are following along and feeling comfortable. Example, if you are saying like this, the next step in your treatment involves starting you on a medication to lower your blood pressure. How are you feeling about that? So here you are pausing and asking the patient how they feel about it. You are opening up to a conversation for them to express concern, misunderstanding, or ask question. It's not like you're just giving your input and without giving them the space. No, you are pausing and asking each questions, asking about their views, their opinions, their understanding. So this step is pretty important. And the next one is encouraging the patient to contribute to reactions or their feelings. This part of the criterion focuses on the understanding how the patient is feeling. You should encourage the patient to share their emotions, thoughts, or concerns about the information you are giving to them. Example, you can say like this, like, I understand this is a lot of information and it can be overwhelming. How are you feeling about everything I've told you so far? You need to take your time to show empathy and try to encourage the patient to express their emotional response to the information, which is very important, very vital in providing effective care. The next one is checking whether the patient has understood the information or not. After providing information, it's very important to check whether the patient has understood it. This helps ensure that no important details are lost in translation. Say, for example, I have explained the treatment plan. Can you repeat back to me what we have discussed to ensure everything is clear? So here you are encouraging the patient to summarize what they have heard and you are clearing up any confusion. The last one is discovering what further information the patient needs. Sometimes patients may not know what information they need until you prompt them because every time most of us we need a prompt, right? So it's essential to ask if they have any questions or if there is anything else they would like to know. Example, if you are saying like this, before we finish, is there anything else you are concerned about? Or would you like more details about any part of the treatment? Here, you are inviting them for further questions. This shows that you are willing to provide additional information and ensures that the patient's needs are fully addressed. Got it? Let's see some of the do's and don'ts for information giving. Establish what the patient knows to prevent repetition. You need to identify and establish what the patient requires in order to prevent repeating information unnecessarily. And try to pause periodically then and there. Allow time for the patient to ask questions or express their concerns. Encourage them for emotional responses to improve your understanding and check understanding by asking the patient to repeat information in their own words, whether they have understood it correctly or not. You will come to know when they express or when they give you the feedback. Ask if more information is needed to cover all their concerns. There are some don'ts. Don't assume the patient understands without confirming or without checking. That's not the right way, isn't it? And do not overwhelm the patient with excessive information at once. Don't give them too much of information. Do not rush through explanation without pausing for reactions or without pausing for feedback. Don't ignore the emotional state of the patient when you are delivering difficult news because that is very important. And here are some final thoughts in both criteria, summarizing information and giving new information, right? The core idea is active listening and engagement. You are not just providing information, but you are promoting an interactive conversation where both you and the patient are on the same page. So always remember to check for understanding and give them room for clarification. By engaging this way, you're not only improving your communication skills but also ensuring better outcomes for your patients. I hope you like this video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.